think we're ready. Okay. We are live. All right. Hi, everyone. Welcome to our latest episode of Dataverse. This is our monthly live stream where we share new data and bring together experts to have a good conversation and give advice. My name is Laura Wronski. I work on SurveyMonkey's research team. And today we're going to talk COVID data. So everything, it's been the number1 conversation for the past 6 or 7 months. It's infiltrated everything. So we have so much data to share on this topic. Today we are joined by John Brownstein, Chief Innovation Officer at Boston Children's Hospital, Professor at Harvard Medical School, and Director of COVID Near You. COVID Near You is a joint team of epidemiologists at Boston Children's and Harvard Medical School that uses crowdsourced data to help citizens and public health agencies identify current and potential hotspots for COVID-19. Since early May, SurveyMonkey has partnered with COVID Near You to survey about 50,000 people every week. So today we'll discuss how surveys are really proving to be a key data collection tool for public health researchers and business leaders alike during coronavirus. So here from SurveyMonkey, we have Jon Cohen, who is SurveyMonkey's Chief Research Officer, to talk through everything on SurveyMonkey's side. And he's been involved in every coronavirus-related conversation, every media-related data story that we've told for the past several years. So welcome to both of you. Thank you so much for joining us.
Thank you, Laura.
So today we want to start off with kind of one big data point from the survey that we've been running collectively together for the past several months. So as the school year begins, one data point we have is that just fewer than 4 in 10 parents across the U.S. say their child or children will be attending school in person at least some of the time. So fewer than 4 in 10. I think we have a chart that shows this. Not only do we have that data point, but we have it broken down by the age of the child. So for parents with children in grades 1 through 5, middle school, high school, or college, just more than 1 in 4 in 10 say their children will be attending school remotely because the school is online only. Twice as many say their children will be attending school remotely because they chose that option for them. Twice as many as those who say. So what's interesting to me about this chart is that the numbers are also consistent by grade level. And I think, John Brownstein, could you jump in and tell us about what this looks like from a public health perspective? What do you expect to see with the data?
Yeah, I mean, I think there's definitely a patchwork that we're seeing across this country, absolutely, given that, we had a lot of months to prepare for the eventual school opening. And unfortunately, many parts of this country sort of left the COVID pandemic sort of run wild. And unfortunately, we'll talk a little bit later about mask wearing and social distancing. But the challenges are clear that many parts of this country, including the South and now the Midwest, are lighting up. And it creates an environment where it's virtually impossible to go full-time in person. And so as much as some of the parents that we surveyed want to do in-person, remote learning is just the sort of the main option that's being afforded, or clearly the hybrid model. Importantly, there's some clear differences in sort of how this virus impacts different age groups. As we learn more and more, we're recognizing that, in fact, the younger age groups are probably spared more than some of the older age groups. When you look at mortality, even though the numbers are small, the numbers of deaths really congregate in those that are on the older side of the pediatric spectrum, sort of 10 to 24. Youngest kids tend to be have the less severe impacts. On top of that, in-person learning for those grades is just so much more important. And so there's definitely a bias towards trying to push the youngest kids back into school while, focus on remote learning in the older age groups. That being said, clearly a lot of parents we're seeing are choosing the remote option, just given the fact that there is this underlying community transmission happening in the communities. And while maybe the kids themselves will not have the sort of the impacts of the virus, they all represent bridges to vulnerable family members, parents, grandparents. And so if you have active transmission, you add kids who are vectors, maybe as good as adults, maybe not as much, but you put them into a school setting, and that creates a real challenge for keeping this virus under control.
Great. Thanks for kind of going through all of the different.
And Laura, let me just say one general thing. You mentioned at the outset that, public opinion on the coronavirus infiltrated, I think is the word you used, everything. I mean, everything is implicated in the pandemic. We're talking now about schools, and we'll dive in just a second into more of those data that are crucial to understanding what's happening, but it goes across the board. It's, it's not only about sports, it's about kind of, a whole range of other things and politics, we're just after Labor Day. It's the traditional start of the political season. Obviously, we've been hot and heavy in it. We can talk later about how, coronavirus and attitudes for that have kind of affected politics, but it's everywhere. So that's why we've done such a major effort around surveys. And John can talk, more directly about the usefulness of surveys to the, kind of the number one issue of the day, which is the coronavirus. But it does, as you said, infiltrate everything. I just wanted to say that at the outset because it's so interesting as from the public opinion researcher's perspective. Like there's never been one thing that has mattered to so many for now such a long period of time that we're just really understanding the dynamics in the public.
Yeah, no, John, you're leading right to the next point we kind of wanted to talk about was we show the differences by the age of child so far, but for that one question on are you planning to send your kid back to school in person or remotely? But there are all these differences that we typically look for when we look at public opinion research. So what are the cuts by race? What are the cuts by income? Do you see the same patterns in that sending your kid back to school question by the same things that you typically look for in public opinion research?
Yeah, absolutely. And what we see in these data, and we've now, I think, passed 600,000 or 700,000, U.S. People in the U.S. ages 13 and up with COVID near you since late April. And so we were able to look at those really distinct differences. And what we see on race and ethnicity, which is a prime lens to looking at public opinion data, even more so, with the disparities we're seeing now. But we see that, kind of, and if we can pull up a chart, showing that, kind of white adults are far more apt to have their children be in school at least part-time in person. Mm-hmm. And this is a huge gap. If you just take a moment to, sit with these charts, John mentioned, the importance of having particularly elementary school children in school settings, or kind of the benefits that has. We see that 50% of white parents of people who have kids in grades 1 to 5, and about the same percentage in daycare or kindergarten up to middle school and even high school and college have their children exposed to in-person settings at least part of the time. In many ways, this is exacerbating, a disparity in educational opportunity that we've seen before, but we see it now, kind of in stark contrast, kind of in the groups that are here. And these are really only public opinion data can show this. Mm-hmm. We don't have a national school census that is showing this, but we're showing the differential opportunity that, people of different race and ethnicities, and we'll show in a minute how that, kind of also overlaps with income. But there is an unfairness that's endemic in the educational system that is, kind of being shown in, kind of bas relief to kind of go on the art motif in John Brownstein's background, kind of in a clear way.
Yep.
Yeah, and then the last thing kind of on this point is, I think you've both mentioned the fact that politics is interwoven with this too. And John Brownstein, I know you, when we were kind of pulling these data together initially, you asked for a cut by party. And I'm not sure if we have that chart, but we did see these the same way that we saw differences by race and income and those sort of typical public opinion cuts, we saw differences by partisanship too, where Republicans are much more likely to say their kids are going to school in person versus Democrats who say their kids are working remotely. What were you looking for when you were looking for that kind of initial look?
Yeah, I mean, I think, we understand that this pandemic has been politicized in ways that are very unfortunate. We've seen sort of how public health has been sort of put on trial a little bit. And we're talking about tried and true sort of long-term public health approaches, social distancing, mask wearing, quarantining, testing, isolation. These are not, these are science-driven sort of interventions, But unfortunately, because especially since they've been sort of juxtaposed against economic activity, they've become very political. And so when we start looking at some of these cuts by party affiliation, you become very aware of some of these issues, right? So whereas, on the Republican side, we're seeing reductions in sort of mask usage and recognition around sort of the value of social distancing and that translates to schools. So sending your kids back in a time when in a community where there's a lot of active transmission. Unfortunately, that is a concern because these are evidence-based decisions. These are not political concepts, and we're going to see that further as we move into the fall. As the vaccine becomes available, we're going to see an increasingly politicized sort of, public health intervention. And we're going to see those decisions sort of line up against party affiliation where, but then it'll be very interesting to see sort of those differences given who sort of is advocating for the vaccine, who, what steps that vaccine has been vetted, the data that supports it. It may not be obvious in which direction party affiliation will dictate vaccine uptake, but there will be absolutely a difference.
And ultimately, it's about messaging, right? We look at these differences because, as John's pointing out, there is, public health officials are trying to influence people's behaviors because, as we'll see later, those behaviors directly affect, kind of the transmission and transmissibility of the coronavirus. And so kind of how do we influence behaviors from an evidence-based perspective and when people are seeing everything through a partisan lens or seeing everything how they affect their particular group. And so kind of exposing these data can also paint, kind of the pathway or at least light the pathway in terms of understanding how to communicate to people in a way that they're not going to understand, in a way that, there should be, to get back to the data chart on, grade of school, there should be a difference there. There's not. And what we've seen with many colleges is the colleges rushing to open because of tuition or not. Won't get into that debate. But, kind of there's a big focus there and not on elementary schools. And from public health perspective, it should be the opposite.
Yeah.
Yeah. Okay, great. So I guess at this point, I think I want to take a step back and explain where we're getting this data from and explain kind of the partnership between SurveyMonkey and COVID Near You.
Thank you. Sorry, we're so eager to jump in. We just jumped right in, but the context is always helpful.
So one advantage that we're aware of in terms of surveying continuously is that we at SurveyMonkey have been able to track trends over time. We do it for a lot of our surveys, but this partnership with COVID Near You really accelerates that and broadens it and puts the public health perspective on it. So John Brownstein, can you talk through COVID Near You a little bit? How does it work?
So I've been working on this project, participatory surveillance now for closing on 10 years. It was a project actually termed Flu Near You, and actually is a byproduct of the movie Contagion, which I think many people now at this point have seen through this pandemic. And we were actually collaborated with the producers of the film to create a way to engage people in public health. And the mission of the movie was all about social engagement around the risk of a pandemic. Clearly, a pandemic does more than a movie can engage people. But we created this product called Flu Near You, where we engage people to just say how they're feeling. And through that collection of data, through sort of this crowdsourcing information, we could get direct insights about flu in populations and work closely with the CDC and many other public health partners to build a data feed of sort of data from the people, by the people, for the people. So we then pivoted that project to a project called COVID Near You as COVID was emerging. Same concept, engage people on a frequent basis on every few days for COVID Near You through text message campaigns to just collect symptom data. And from that, we could get really deep insights, real-time information about what was happening with the pandemic, when it was sort of taking a turn, say in the South, when we start seeing the reemergence of the virus happen, the second wave. And through that sort of collection of over now a couple million responses, we get this really detailed data by demographics and geography. And that's a system that we will maintain now for years to come. What's unique about what we have with the partnership with SurveyMonkey, SurveyMonkey was able to replicate some of the same questions we ask, and they tap into a very different sort of source of individuals that we as COVID Near You directly didn't have. And so that just in itself augments the data, because now we have the more people in the system, the better high resolution that we can start to query the data as far as details of demographics and geography. But more importantly, with SurveyMonkey, because the system has been so flexible, we can quickly start injecting other questions that are very hard for our system, which is very fixed on specific questions around symptoms. We can start asking questions by political affiliation. We can start looking at vaccine hesitancy. We can start looking at sort of impacts in schooling. And all that being said, so it becomes sort of on an ability for us to clearly get the pulse of the population in addition to some of the symptom data. And we'll talk in a little bit about some of the interesting insights around mask wearing. All that data collected is a very unique data set. And we just would not have the ability to pivot the system in the ways that the SurveyMonkey tool. So it's a very complementary data source for us.
Yeah, I think that the other advantage from SurveyMonkey's perspective is we can offer nationally representative responses. So whereas anyone who's watching this video now or anyone online can go to the COVID Near You site, type in their information and add their data, whereas SurveyMonkey's data, maybe John, maybe you want to speak about this a little bit, but our results, part of what we can offer is nationally representative results that are weighted to be matching the U.S. population. And so we can look for trends there that are meant to kind of tell a unique data story as we're collecting data.
With all of these efforts, you're battling against self-selection, and how do you do that? But we'll save the survey research for another time. You mentioned mask wearing. I want to dive into that because that's been so front and center in the unfortunately the debate, but certainly in kind of how are we addressing the spread of the pandemic, and what's in our toolkit in terms of how to do better going forward. So I don't know if I think we have some mask data.
Yeah.
Yeah. We've been asking people about whether they're wearing masks. So we can do a lot of interesting stuff. We can summarize that since we have this large scale. So you both know this, but to share with everyone else, we can summarize this data by geographic region, by whether someone is experiencing COVID symptoms or has a pre-existing condition. So some data from our mask research. 87% of people are very likely to wear a mask when they go grocery shopping. 73% are very likely to wear a mask when they are working at their office or workplace. 42% when visiting with friends or family inside their home, and 31% when exercising outside. So those are some questions, as John mentioned, those aren't kind of the core COVID Near You questions, but those are ones that we can ask as kind of these issues come up.
And all of those numbers have increased over time, right?
Right.
So kind of in terms of the public health messaging, some of it is breaking through. Like there has been an increase when, kind of outbreaks happened and where outbreaks happened. In general, mask wearing increased, but the pattern isn't as clear as we might hope in terms of stemming the epidemic. I think we have some charts from what I considered a pretty exciting paper that came out of these data. Do we have that?
Yeah, let's see. We do have we have like a US map chart. Yeah. Let's see if we can get that to pop up.
So I mean, what's exciting is that, some of the traditional surveys that are out there have been giving these sort of high level national estimates of mask wearing and the changes over time. But, the really interesting sort of findings happen when you start to drill down at a high resolution and you start looking at the data at a sub-state level. You start to see really important differences in the uptake of masks. And also what's interesting is clearly there's a lot of heterogeneity and there's not necessarily a ton of dependence on mask mandates. Mask mandates do have some impact, but generally there aren't sort of the deciding factor whether a population sort of decides to wear a mask. There's sort of the public health guidance and education really plays such a strong role. And what's interesting is, with this kind of data, we can start to look at empirical evidence for the impact of mask wearing on sort of the epidemic trajectory. So, what we set out to do was say, okay, now we have this highly granular spatial temporal data on mask wearing. What does that mean in terms of transmission in the community? Does a community that decides that mask wearing is effective? Does that bring the transmission down? And the answer is yes. And as much as that's super obvious, probably to people thinking masks work, we don't have large scale data to support that. And clearly, for many parts of the country, having that empirical evidence is critical to making the decision of wearing that mask going forward.
I think that, it's absolutely right. And, it's not as obvious to everyone that mask wearing matters, particularly the way that the epidemic is covered. There could be a story that gets outsized, kind of exposure because it says something counterintuitive, or in some unfortunate cases, something that's wrong. And so having kind of more empirical data to showcase, kind of the connection between mask wearing and social distancing and the powerful combination of the two, and how they have an effect on driving that reproductivity rate of the virus down under kind of transmissibility, that R equals 1, R not equals 1. John, you'll correct me here. I can't play epidemiologist even on LinkedIn, but kind of driving that down through the combination of mask wearing and social distancing is critical, and these data show it. But you said something earlier that I wanted to kind of go back to. It's not about the mandates, and that also comes up through these data. Now, we're going to continue to collect data. We'll continue to look at mandates at more granular levels. We took a look. Your team, John, took a look. Ben Rader, kind of took a look at kind of the connection between mandates at the state level and the other data, and we didn't find a connection. And so, kind of mandates aren't the answer. So, what is the other group of public health messaging and other types of messaging, and what political leaders or celebrities or fill in the blank needs to kind of emphasize mask wearing and social distancing to kind of nudge behavior in the right direction now that we've shown that connection?
Yeah, I think we can kind of wrap up at this point, but to end on the final point, one of the key findings from this joint research has been that all of these things are making a difference in these areas. So for where people wear masks, they're also likely, in areas where people are wearing masks, they're also likely to be practicing social distancing and to be doing all those things. So is there more kind of on that last final point to kind of go through and emphasize for everyone watching? Or
Yeah, what was interesting in this particular study is that it was sort of integration of data from SurveyMonkey on mask wearing plus the sort of social mobility data from Facebook and Google. And so through that mashup, we could sort of look at that interface. There's a sweet spot between sort of some level of social distancing and mask wearing where you get the best effect. Mask wearing alone can do something, but it can't get you the whole way, and social distancing alone can't get you the whole way. So, it sort of, what's been exciting overall for COVID is to get this level of engagement from sort of companies that the business model isn't collecting public health data, but they have been able to adapt their platforms to sort of support public health surveillance. So as a background for me, like being in public health surveillance, to see sort of this investment from companies to actually direct their platforms that have the massive scale like SurveyMonkey to collect this incredible detailed data to support public health. It's, at least a good silver lining for public health people who have been sort of data poor in some ways for this kind of resolution. And so to be able to, we have a figure here just showing this data of mask wearing and transmission coming down. And so that the highly granular data by geography was allowed us to understand sort of where we need mask wearing as an example to get transmission below 1, which then leads to the virus dying out in community. So again, this wouldn't be possible without these types of innovative collaborations.
Yeah, that was, that's an excellent recap of all of the work so far. I think that's been the goal of the project from the start, was making sure that SurveyMonkey can provide our expertise in terms of asking questions and turning them around quickly. And we have all these examples of surveys that we've done, from on the business side. So HR templates or, resources that we have available for people who are using the product, but we can also provide this kind of expert solutions for people who are doing, broader public health work here too. I think that is all the time we have. Any last points from either of you, or we can wrap it up? I don't think we have any questions that came in quickly.
I love John's kind of combination of it all as a data mashup, and here at Dataverse, there's no mashup like a data mashup. So we're thrilled to have our data play a key role here, and we'll keep going because sadly the kind of coronavirus is with us and will likely be with us for a long time, and we'll keep surveying because I think data like these can be super helpful, and we're thrilled that they are in these initial phases.
Yeah.
Great.
That's it. Thank you, John, and thank you, John, for joining today.
Thank you, Laura.
Thank you.
Joke until the very, very end. And thank you, everyone, for watching. We will link and share all of the resources that we've talked about, and we'll make sure that if anyone is looking for more data, we are happy to provide. So thanks again, and we'll see you next time.
Thank you.
Bye.